Hello, my name is Elif. I make anatomy and medicine videos with my own illustrations. In this video, I'm going to talk about heart anatomy and its external structures. For more anatomy and medicine videos, make sure you subscribe my YouTube channel, and to be notified of new videos, click the bell icon. Let's get started. Heart is a vital organ that keeps us alive. It acts as a muscular pump and provides transportation of blood throughout the body. If the heart stops, the blood flow will be cut off, so oxygen, the main source of life, cannot be transported to human cells. The brain, which will be most affected by oxygen cessation, is irreversibly damaged within 4 to 5 minutes. Heart pumps about 55 to 80 milliliters of blood per heartbeat and 6,000 to 7,500 liters of blood daily. Heart is the place where deoxygenated blood in our body is collected. The heart acts as a muscular pump that transports oxygenated blood to whole body and also collect deoxygenated blood from whole body parts. There are two kinds of blood circulation in the body: systemic circulation and pulmonary circulation. While systemic circulation is a transportation between the heart and the rest of the body, pulmonary circulation occurs between the heart and the lungs. There are two main veins that transport venous blood to the heart. These are vena cava superior, in other words VCS, and vena cava inferior, abbreviated as VCI. These are Latin nominations of these veins. Vena cava superior or superior vena cava or SVC brings deoxygenated blood of the head, neck, both upper limbs and from structures within the thorax. Vena cava inferior or inferior vena cava or IVC transports deoxygenated blood from the lower extremities and abdomen back to the heart. Superior means upper, basically venous blood of upper part of the body brings back by vena cava superior. And inferior means lower, so venous blood of lower part of the body brings back by vena cava inferior. These veins carries deoxygenated blood into the right atrium of the heart. Right atrium is also known as atrium dextrum in Latin. Deoxygenated blood from the right atrium passes into the right ventricle, ventriculus dexter. The blood passing from there to the lungs with the pulmonary trunk, truncus pulmonalis. Truncus pulmonalis divides into pulmonary arteries. Please note that although the pulmonary arteries are arteries, they carry deoxygenated blood after passing hilum pulmonis. Hilum pulmonis means hilum of lungs. Pulmonary arteries continues as arterioles, and arterioles become capillaries. But not only the veins and arteries, also the right and left continuation of the trachea enter through the hilum of the lung. Right and left continuation of trachea is called as principal bronchi. Principal bronchi divide into secondary bronchi, and secondary bronchi into tertiary bronchi. Tertiary bronchi is also known as segmental bronchi. Tertiary bronchi give branches called bronchioles. The air taken from mouth and nose passes through the trachea to the bronchi and to its branches, and they are end in small sac called alveoli. Alveoli are tiny balloon-shaped air sacs in lungs. There is also a capillary network outside each of these alveolar sacs. In this sac, gas exchange takes place. Carbon dioxide is removed from the blood in capillaries and oxygen enters. It is transported to venous arteries and pulmonary veins via capillaries when it is oxygen poor, while it becomes oxygen rich. Please note that pulmonary veins, although it's a vein, carries oxygenated blood because it comes from the lungs. So, oxygenated blood, arterial blood, comes from the left atrium through the pulmonary veins. Oxygenated blood in the left atrium comes to the left ventricle. From here, the oxygen-rich blood pumped into the aorta is transmitted to the whole body. The heart resembles a quadrangular pyramid and its apex pointing downwards while its base pointing upwards. It's in a position slightly oriented to the left from the middle of the sternum. In the mediastinum medius, the two-third majority of the heart is located on the left side. What is mediastinum? The mediastinum is the space between two pleures. Now you can see relationship of lungs and heart with the mediastinum in the coronal section. But in sagittal section, the position of the heart in the mediastinum is more clearly understood, so we will discuss mediastinum in sagittal section. The mediastinum is divided into two main parts according to its position: upper and lower. Lower part is also divided into three sections within itself. While determining these sections, an imaginary plane is taken as basis. Let me show you this plane in a sagittal section of the thorax. This plane is between angulus sterni and lower edge of fourth torcal vertebra. Superior upper part of this plane is mediastinum superius. Mediastinum superius, which is bordered anteriorly by manubrum sterni and posteriorly by the first four thoracic vertebrae. Inferior part of the plane between angulus sterni and lower edge of T4 is mediastinum inferius. Mediastinum inferius is divided into three parts. Mediastinum anterius, this part of mediastinum between the pericardium and corpus sterni. Mediastinum medius, this is the widest and middle part of mediastinum inferius. Heart is located in mediastinum medius. And mediastinum posterius, this is located between bifurcatio trachea, pericardium anteriorly, and 5th to 12th thoracic vertebra posteriorly. From inside to outside, heart consists of three layers. These are endocardium, myocardium, and pericardium. In another video, I will talk about each membrane in detail. In this video, we will focus on pericardium. Pericardium surrounds the heart externally and resembles a bag-like membrane. Since this membrane is not attached to the heart can move by sliding within this membrane. It has two layers. The other one is pericardium fibrosum, and the inner one is pericardium serosum or serous pericard. It prevents the heart from suddenly enlarging. Pericardium serosum also has two layers. These are lamina visceralis or epicardium and lamina parietalis. The lamina parietalis is located outside, it located more externally and adheres to the pericardium fibrosum, while the lamina visceralis, called the epicardium, is firmly attached to the heart. The space between these two layers is called as cavitas pericardialis or pericardial cavity. The heart has relation anteriorly by sternum, adjoining costal cartilages, left lung, and apex of the pleura. Posteriorly, on the back side, it has relation by the esophagus, azygous vein, hemiazygous vein, thoracic duct, descending thoracic aorta, and vertebra. The lungs are located on the right and left sides of the heart, so it is related laterally with lungs and pleura. Superiorly, it is adjacent to the bifurcation of the main pulmonary trunk. Moreover, on the lower side, which is inferiorly, the heart is adjacent to the diaphragm. The length between heart's apex and its basis is 12 centimeters. Apex means heart's lower tip and basis means upper wide area on its backside. The heart's width in the horizontal axis is 8 to 9 centimeters and its anterior-posterior width is 6 centimeters. The heart weighs between 230 to 280 grams in females and 280 to 340 grams in males. Human heart consists of four chambers. These are right atrium, or in Latin atrium dextrum, right ventricle, or in Latin ventriculus dexter, left atrium, which is atrium sinistrum, and left ventricle, which is ventriculus sinister. These chambers are separated from each other by grooves on the outside. Human heart also has two atrias and ventricles on the right and left sides. Each atrium has auricular enlargements resembling a rough cube. These ear-like cuboidal enlargements are called as auricula because auricula means ear in Latin. The auricula on the right atrium is called as right auricle or auricula dextra, while the auricula on the left side is called as left auricle or auricula sinistra. The heart has four margins and five faces. Well, I had talked about the heart resembles an upside-down quadrangular pyramid, so for a better understanding, I will show you each face on this pyramid as a model of heart. Now let's look at each face in detail. Anterior part of the heart is sternocostal surface or anterior surface. This surface adjacent anteriorly with sternum and adjoining costal cartilages. Sternocostal surface is also known as in Latin facies sternocostalis or facies anterior. Right face of the heart is right pulmonary surface. This is also known as facies pulmonalis dexter. Left pulmonary surface is also known as facies pulmonalis sinister. Inferiorly, the heart sits on the diaphragm, so inferior surface is also known as diaphragmatic surface or in Latin, facies diaphragmatica, or facies inferior. Posterior surface of the heart is base. This is also known as basis cordis in Latin. In addition, heart has four margins. Right margin of the heart is margo dexter, left margin of the heart is margo sinister, superior margin of the heart is margo superior, inferior margin of the heart is margo inferior. The base of the heart, which looks like a quadrangular pyramid, is called as basis cordis. Basis cordis directed posteriorly to the right and upwards. In a standing person, basis cordis at the level of 5th to 8th thoracic vertebra. The apex, which is oriented on the anterior left side of the heart, is called as apex cordis. Apex cordis belonging to the ventricles sinister is covered by left lung and pleura. Not only the apex cordis, also the E-shaped auricula sinistra is visible on the facies sternocostalis. There is a conic-shaped pouch at the upper left part of right ventricle. Pulmonary trunk arises from here. This conical pouch named as conus arteriosus or infundibulum. One of the structures seen on this surface is the groove between atrium and the ventricle. Since this groove resembles a crown in terms of its extension, it is called as sulcus coronarius, which means crown-shaped groove. The anterior part of the sulcus coronarius is visible when viewed from the facies sternocostalis. Right atrium forms the upper right major portion of sulcus coronarius. Coronary arteries feeding the heart pass through this groove. This artery is right coronary artery or arteria coronaria dextra. Also from coronary sulcus, right coronary vein and anterior cardiac veins passes. There is another coronary artery which arises from ascending aorta. This artery is left main coronary artery or arteria coronaria sinistra. It is also known as left ascending artery, or it uses as its abbreviation, which is LAD. It is one of the two main coronary arteries that supply to the heart with oxygenated blood. Again on this surface, there is another groove between the right and left ventricles. Since this groove is located between two ventricles and anteriorly, it is called as anterior interventricular sulcus or sulcus interventricularis anterior. The anterior interventricular branch of left coronary artery or ramus interventricularis anterior, great cardiac vein or vena cordis magna, pass through this groove. The inferior part of the heart is flat and sitting on the diaphragm. This surface is called as diaphragmatic surface or facies diaphragmatica or facies inferior. Most of the facies diaphragmatica is formed by left ventricle and the remaining parts by the right ventricle. On posterior surface, there is another groove between the right and left ventricles. Since this groove is located between two ventricles posteriorly, it is called as posterior interventricular sulcus or sulcus interventricularis posterior. The posterior interventricular branch of right coronary artery or ramus interventricularis posterior, it is also known as posterior descending artery or PDA, middle cardiac vein, which is vena cordis media, pass through this groove. There is a sinus which courses along the posterior wall of the left atrium into the left atrioventricular groove. This sinus is coronary sinus or sinus coronarius. The coronary sinus is located in the posterior portion of coronary sulcus on the posterior surface of the heart. It normally drains into the right atrium. Posterior vein of the left ventricle or vena ventriculis sinistri posterior is also visible on this surface. Oblique vein of the left atrium is seen in here. It is also known as oblique vein of Marshall or vena obligua atri sinistri, is a small vein that descends and also drains the posterior wall of left atrium. It drains directly into the coronary sinus with the great cardiac vein. It is named referring to English surgeon, anatomist John Marshall. Great cardiac vein or vena cordis magna or vena cardiaca magna runs in the ramus interventricularis anterior. It drains anterior surface of the heart. It is the venous part of the left anterior descending artery. Also, this is the main tributary of the coronary sinus. Circumflex branch of left coronary artery, ramus circumflexus arteria coronaria sinistra. It follows around the bottom of the heart in the left atrioventricular groove. It also gives branches to the left ventricle. Ramus posterior ventricular sinistri. This artery is located posterior side of the left ventricle. When you pay attention, nomination of this artery, you can understand where it is located. Posteriorly on the left ventricle. Ramus posterior ventricular sinistri. On the left margin of the heart, there is left marginal branch of the circumflex artery. It is also known as ramus marginalis arteria coronaria sinistra, originating at the left atrioventricular sulcus, traveling along the left margin of the heart and it towards to the apex of the heart. On the right margin of the heart, there is right marginal branch of the right coronary artery. It is also known as ramus marginalis dexter. Ramus marginalis dexter arises from the inferior border of the right coronary artery. It supplies blood to the structures of the right atrium. In 10 to 15 of cases, provides the main arterial supply to the sinus node.
Hello, my name is Elif. I make anatomy and medicine videos. If you like my videos, please subscribe my YouTube channel and follow me on my Instagram and Facebook pages.